Kia ora, I'm Holly from the Ovarian Cancer Foundation New Zealand, and I'm very pleased to welcome you to our webinar series. This session is focused on nutrition. We're very lucky to have Gemma Dunkley to present. She is a specialist oncology dietitian who works at the Harbour Cancer Centre. We're also joined by Lisa Almond, who facilitates our online peer support groups. After Gemma has presented, she will have time to answer questions. So if you're attending live, please submit them at any stage using the Q&A feature in the toolbar. I'd also like to let you know that this session will be recorded and published to our website later, so you can watch it back or share it with anyone else who might be interested. We hope this session is informative, but please remember that it is no substitute for individualised medical advice. Now I will pass you over to Gemma.
Oh, there I am. Hi everyone, I'm Gemma. I am the oncology dietitian at Harbour Cancer and Wellness Centre in Auckland. I've been at the centre for about 3 years now and specialise in oncology, and before that I worked solely with women going through menopause. So I have had quite a history in the area, so hopefully I can help you with some questions today. I've got a presentation which I'll share hopefully with you. So I'll share my screen and then hopefully I'll be able to find my talk, which we can go through. That's the last slide. That doesn't help. Okay, so we'll talk about nutrition intervention in the context of ovarian cancer, and also a little bit of general nutrition information that I give to everyone for recovery, prevention, all those sorts of topics that everybody's really interested in. What everyone really knows is that good nutrition is vital for health, for function, for repair. In the context of cancer treatment, if you are nourishing your body really, really well and looking after yourself, then you tend to have more tolerance for your treatment. Generally better managed side effects or less side effects, better recovery between treatments, depending on how far away your treatments are. You'll be able to look after your body composition better. So if you're feeding yourself properly, you'll maintain that muscle mass, which we know is really important when you're having treatment. It also improves outcomes, survival, quality of life while you're having treatment and afterwards. It's also obviously really important after surgery for healing, repair, function. Getting you back up on your feet is really important to be eating the right things. And then obviously after cancer treatment, if you're needing tissue repair, you're rebuilding strength and function. It is essential, really. And I'm not saying that just because I'm a dietitian, but it is proven that the wellness side of cancer is actually really, really important. If you're looking after yourself, you also reduce the risk of further disease. So whether that be heart disease or cancer or anything, if you're looking after yourself, it's never too early to start. And obviously maintaining a really healthy body weight is key for reducing the risk of all types of illnesses. So we're looking to improve your quality of life. Unfortunately, with cancer treatment, post-surgery, with everything that's going on, there are a lot of unwanted side effects, and we'll talk about some of them today. I know there's a lot. The most common ones I'll touch on, but obviously if you're having issues that you want me to cover, then hopefully I can at the end. A lot of them can be nutritionally managed or can be helped with nutrition. Some of them can't, but things that we know we can do for our bodies is making sure that we're eating as well as we can, having as much protein as we can, dealing with loss of appetite, dealing with bowel changes, which is really, really common, dehydration, fatigue, unwanted weight loss, that sort of thing. Sometimes unwanted weight gain as well. So there's both of those things. So we'll talk a few things that are really common and very popular. I have lots of people come to see me about bowel habits particularly. So through the course of treatment or even before, your bowel habits can be altered. The most common is diarrhea. So really loose bowels. It can be really, really frequent, really, really watery. It's very different for everybody. Sometimes it's only managed medically, but it can also be managed through nutrition. The first thing we do is we look at the fiber in your diet and modify the type of fiber. So there's two types of fiber. There's insoluble fiber and soluble. And with diarrhea, we want to reduce the bulk and the volume coming through, and we want to increase the amount of food that acts like a sponge to absorb the excess water basically in your colon. So we increase soluble fiber in that situation. And the next slide, I'll give you some examples of what soluble and insoluble fibers are. But what we're trying to promote is a soluble fiber will absorb the water and cause a nice, soft, easy to pass stool, and reduce the frequency of the bowel motions, hopefully. The other key is maintaining hydration. So if you've got a lot of diarrhea, then you're going to potentially become dehydrated. So making sure you're having a lot of hydrating fluids. Sometimes we look at something eventually, once we try everything in order, we can look at something called the FODMAPs, which is a very popular way of controlling irritable bowel syndrome. And sometimes it can help with diarrhea. But it's quite a severe full-on diet to follow. And if you're already going through cancer treatment and potentially losing muscle mass and body weight and stuff, we wouldn't put you through that. We can modify that again if that is something that you need. But then also with diarrhea, you need to have just small, frequent meals of soluble fiber, not insoluble fiber, so that you're not ever having a huge amount of food going through your digestive system, and you're creating a really healthy, natural, slow transport of food through your gastrointestinal tract. But as I said, sometimes we try a few things and then we add some things to it, and it's a process. All bowel health is a process. Sometimes we do need a fiber supplement, which is called psyllium husks, which is basically Metamucil, and that will also really slow those bowel motions down and improve the consistency. And often you'll be recommended to take loperamide if it's really bad, and we can't control it with diet, which sometimes you can't because of the medications that you're on. The other thing that people find is constipation. So that can be, again, a result of constipation or medication they've recommended that you take, or it can be a side effect of the diarrhea medication. So it's a lot of things again can come into play. Again, we would modify the fiber in the diet. So we'd make sure that we'd actually balanced the insoluble and soluble fiber. So then we're creating a really healthy, easy to pass stool. Often constipation is worse if you're having more of that really bulky insoluble fiber. So we'd work out a balance that we could achieve that would make those stools a better consistency. And that's depending on what you're actually eating. We have to, you'd have to go through a food diary to make sure that we knew what we were changing and how much you're actually eating at the time. And absolutely maintaining hydration. So if you're at all constipated, more and more water, it is very, very essential that you're keeping yourself hydrated. That if you're not, then that constipation will be a lot worse. We know that physical activity is a stimulant for bowel motions. So the bowel is a muscle as well. So if you're getting your body up and moving as much as possible, that does stimulate the bowels to move. So even anything you can do, whether it's, go for a walk or do some stairs or anything that will help your body move and improve that gastric transit time will help. But again, if it's medically caused constipation, it sometimes can only be treated with medicine. So Coloxal, Senna, Movicol, Lactulose, whatever your medical team recommends that you take in the right amounts, that would help you and not go the other way. So the soluble, my main goal is to look at people's fiber. We talk about bowels a lot in my clinic. I say to my patients, you can tell me anything. I've heard it all before. But the types of fiber is really, really important. So you've got soluble and insoluble. And the soluble fiber is going to help you with diarrhea and with constipation. So it is the soft. So if you think about a pot of boiling water and you put, say, oats in it, and it becomes really, really soft and it absorbs all the water. Or if you had a pot of boiling water and you put some celery and some seeds and nuts in there, boil the water, and they really stay relatively unchanged. So those ones are the ones that you want to avoid, because they will cause the harder stool, and create that bulk coming through. If you've got an aggravated bowel, you don't want that bulk. You want the nice soft stools. So then you'd be focusing on oats. Porridge is great. Barley, flaxseed, wholemeal bread, not seedy bread, not grains or nuts or seeds or anything. Flesh of fruits and veggies. So where possible, peel the veggies, cook the veggies, and have fruit that you can peel as well. So things like grapes would be quite high in soluble fiber. Anything that you can sometimes see coming out in your stool is insoluble. So corn, grape skin, tomato skin, that sort of thing. That's the real insoluble fiber that we'd want to reduce. And psyllium husks, if you want to try them, I recommend 100%. It helps with constipation and diarrhea. You start off really slow. So you'd have like 1 to 2 teaspoons in the morning, and then you can increase it if you need to, but that does have a really huge effect on lots of people. It's a real game changer. So if you are having lots of trouble and you've changed your diet and you still think you could improve it a little bit, then I would recommend trying psyllium. Basically, it's Metamucil. People think that it's for constipation, but it's actually for both. But you have to start really slowly, so don't shock your system. Start really slowly, have lots and lots of water, and then you can build up until you find that you're really regular and happy. I've written down legumes and lentils because they've got soluble and insoluble fiber. So people are a bit confused about them, whether to include them or not. I always say just avoid them for the start and see how you go. And then once you get comfortable and you're feeling like your stools are more regular, then you can maybe try adding some in and see what the result is. It might not change anything at all, but it might make things worse, or you might go backwards a bit. So yeah, just be gentle with the legumes and lentils. They are a really healthy form of vegetarian protein. So if you want to include them, they are really, really healthy as well. But yeah, so fiber is a bit of a minefield. But once you get your head around it, it does make a huge difference for all sorts of bowel issues. The other thing often I find is that people just can't eat enough. They just don't feel like it. They fill up really quickly, and they get referred to me because they're losing weight through their cancer treatment and they don't want to, and they're really becoming deconditioned because they're not able to do enough because they're not hungry. But my general comment to them is just to be kind to yourself and don't stress about it. If it's just a few days post treatment that you're feeling really rubbish and you just feel like I can't eat much, I don't feel like eating much, then be kind to yourself and just do what you can on those days. We do recommend you eat a little bit if you can, small and often, but if you can't, then we just want you to make up for it on the days when you are feeling really, really well, and then it should even out. We don't want you to force yourself to eat and then eventually you'll hate those foods, or you'll feel worse, and you just need to let yourself recover and take those days slowly. Ideally, if you could have something, it doesn't have to be a lot, because often the volume can make people feel really unwell. Then just small, regular, high energy drinks, or a handful of nuts, or just something smaller every 2 or 3 hours will help with your energy levels. It'll help you to not lose too much weight. Sometimes if you have a really empty tummy, that can make you feel nauseous. So having a little bit of something, crackers and cheese, or dry piece of toast with some peanut butter, something small that you can tolerate, that you like, is better than having nothing if you can do it. If you're finding that you've got a really, really low appetite for the whole time between treatments, that's when we need to think about adding in some special nutritional drinks like some of you might know, Ensure and 40-sip, and sort of really high calorie, high protein drinks, so that every time you're sipping on something, you're getting a lot of bang for your buck. You're getting a lot in that mouthful. Ideally, we want every mouthful to count. So whenever you eat, you're having something that's really nutritious and it's got protein and vitamins and minerals and healthy fats, so that you're getting the most out of every mouthful. And so it doesn't have to be a huge volume of food, but even just the small amounts that you eat, you're going to get a lot out of. That's ideally what we want. So in a session, I go through with patients what they're actually eating and what I can replace with something that is going to be more beneficial for them. So rather than just having empty calories, then I can give them something that they'll get more benefit out of. Also, we recommend that you, again, be kind to yourself. If you're feeling that you've got no energy as the day goes on and you just want to go to bed, then make your earlier meals more substantial. So have a really decent meal at breakfast if you feel hungriest then, or have your decent meal at lunch and then just have a snack in the evening. So it can vary. You can make it work for you, and that way you'll get the most out of each day. You don't have to have it looking like a typical day. The key as well to have is food at home that you like, snacks that you like. There's nothing wrong with ready-made meals or frozen meals or anything that that you have the energy to eat and prepare and have small amounts of. The other thing people can do is they can just drink. So you can just sip on really hydrating fluids that have got protein and calories in them. Hydration is important. So if you can find a drink that's hydrating as well as got protein and calories in it, like a smoothie or these Ensure 40-sip drinks I was talking about, that's going to give you the most for every mouthful. In terms of pick-me-up drinks, I thought I maybe had a question come through during the week on a sort of a pick-me-up drink. Depends what kind of pick-me-up you're talking about, whether it's after exercise, it would need to have protein in it, whether it's, might need electrolytes in it. If you're thinking about trying to avoid too much really, really sweet, high calorie drinks, then we could have things like you can try green tea or matcha tea, or I have a couple of other ideas that I'll think about. Kombucha, green tea, matcha tea, kombucha, and there's one more that's got a really long name that I can't think of. But those sorts of things are pick me up, not really high in caffeine, will give you a bit of variety, different flavors, and it might make you feel, that you're hydrating, but you're also having different kinds of things, not the same drink all the time. So I hope that's covered some of those things. The other thing that people find, as well as not being able to eat much, is that they're feeling really tired all the time, whether or not that's just after treatment or whether it keeps going throughout the gap between your treatments. Nutrition can help. So what we talked about before really is eating small and often. The other thing that can really help with fatigue is exercise. So if you can, you might have talked about this last week, but if you can do any movement that you feel comfortable with, if you can see an oncology physiotherapist or oncology exercise physiologist who can give you exercises to do at the stage that you are, and they know about treatment side effects and treatment fatigue, and they'll know how to give you a program that you can do at the stage you are. So that is key, making sure that you're moving as much as possible every day. Just doesn't have to be 30 minutes, it's just move. That really does help pick up those energy levels. Same as I said before, just small, regular, every 2 or 3 hours, something high protein, high energy, and take the pressure off the main meals, but that'll give you a little bit of something to go on. So you're never in deficit. You've always got something that's giving you some energy, whether it be a drink. Again, make sure you're having snacks and foods at home that you like. So, make yourself a nuts and seeds scroggin, or make sure you've got some really nice nut butters or avocado, So you've got something small and high energy, high impact that you can have just a mouthful of as you're moving through the day. Milk drinks are great. Smoothies are great. Protein drinks are great if you want to put a protein powder in a smoothie. Again, anything you can have will give you a little bit more energy. Maintaining hydration, I won't say this enough, but it is key. If you're not hydrated, you will feel more tired. So if you can maintain that regular intake, we're aiming for about 10 glasses of a hydrating fluid every day, which sounds like a lot, but if you think about it, 200 mils, throughout the day, if you can get to 8 even, that would be really good. And it does mean that you'll be better off, you'll be more energetic. It helps your body take all the nutrients to the right cells. It helps your body get rid of wastes. It helps your bowels move. So it is really, really key to stay as hydrated as possible. And the last thing is obviously, like I said before, you have to be kind to yourself. And if you need to rest, let yourself rest. We do tend to say, if you need to rest, limit it to less than 40, definitely less than 60 minutes. So then it doesn't interrupt your nighttime sleep, hopefully. But do let yourself rest if you need to. And then, plan your day so that you're resting and eating when you can as well, and drinking. Okay, so what we're wanting to do is to avoid any kind of further cell damage. So we're trying to keep your healthy cells alive and thriving and nourished in what we eat. So we're trying to avoid cell damage, and lots of things people talk about, you've heard, are critical to avoid if you can. So things like processed meat, any processed meat, if you can have that as little as possible. I haven't written it here, but too much red meat. So we're trying to reduce the amount of red meat people eat to no more than twice a week. No burnt meats, nothing burnt, no charring, no overly cooked anything if possible. As little alcohol as possible, the less the better. And reducing trans fat. So that would be reducing processed foods as much as possible, and just having really, really nourishing, healthy, fresh foods that don't come from a packet and don't have a lot of saturated fat and all sorts of things added to it. So we're trying to avoid cell damage. We're trying to also avoid inflammation. So if you've got constant inflammation, then you also have a greater risk of cell damage. And if you're trying to avoid inflammation, it means that you're following a really healthy diet. If you're trying to avoid high GI carbs, so that would be, not sure if the glycemic index is something that you have talked about before, but the foods that are not very high fiber, you want to avoid those. Any kind of refined sugar, if you can avoid that, alcohol again, and processed foods are foods that can cause the body to have more inflammation. And that's not, as the cells, the cells don't like that constant inflammation. So that's what to eat less of. If you're thinking about what to eat more of in the terms of good nutrition, so this is one thing you can do to help yourself when there's lots of things out of your control. If you're feeling that you have the energy and you wanting to look at your nutrition, antioxidants is key. So fresh fruit, vegetables, legumes, nuts, seeds, herbs, spices, a variety is going to give you a variety of antioxidants, minerals, vitamins. What we say is a rainbow of colors. So if you can do a rainbow of vegetables and fruit, all different kinds of plants will give you all the antioxidants you need for cell repair, for the development of healthy cells, in terms of looking after hair, skin, nails, making sure that you've got those really healthy cells coming through. There's nothing wrong with coffee. So coffee has also got antioxidants in it that we know is really helpful and protective, but not too much coffee. So if you have coffee and tea and you're having it several times a day, if it's replacing a time when you should be having water, then if you're hydrating with coffee and tea, then we recommend reducing it. So, but if you're having 1 or 2 coffees a day, absolutely fine. You don't have to stop those as well, as long as you're also drinking hydrating fluids. And the other things that help are obviously getting enough sleep, maintaining exercise, and meditation can help. So if you are into looking at the wellness perspective, which is what we are, then relaxation is really, really helpful. It does reduce stress, it reduces inflammation, it helps digestion. So if you're thinking about meditation or relaxation, I would recommend going down that path. But equally, exercise as much as you can, and look at ways to improve your sleep. So again, anti-inflammatory, what you talked about, antioxidants, fruits and vegetables, herbs and spices, a variety. So no one particular spice, no one particular food is going to make a huge difference. The idea is that we're having a really balanced variety of all foods, all food groups, and healthy fats. So olive oil, avocado, fish, nuts, seeds. Oily fish at least twice a week is really, really good for circulation, for repair, for immunity. So if you like fish, if you can add that in twice a week, that is really beneficial. And that can be fresh, frozen, tinned, like salmon, tuna, sardines, that sort of thing. But fish is all good, but the oily fish is particularly good. So in terms of ovarian cancer and hormone-driven cancers, we know there are some foods that are protective, potentially protective. Lots of evidence shows that cruciferous vegetables, they have something called I3C. Now I call it I3C, but it's called, and I have to look it up, indole 3-carbinol, which is basically being studied to show that it can reduce inflammation and be beneficial to reduce hormone-driven cancers. So that would be in cruciferous vegetables, really. So if you're including a variety of vegetables in your diet, then you can also include broccoli, kale, cabbage, Brussels sprouts, that sort of thing, when you can. This other thing that's being studied really and shows some good prospects is ellagic acid, which is in bright red fruits and berries, blackberries, strawberries, walnuts, that sort of thing. It's also been found to have a really good protective effect, and they're all high in antioxidants. So those two things, particularly for hormonal cancers, we recommend, as well as all the antioxidants. So again, a variety. We always say food first. So if you're going to eat it, it's going to be more beneficial for you. It's biologically available for your body to use. And in food form, your body will get the most out of it. If you're feeling that you need to have more nutrients above and beyond your intake, your diet, we don't recommend taking any sort of supplements, no high dose supplements during chemotherapy particularly. It's been proven to sometimes counteract the effectiveness of the chemotherapy drugs. So anything high dose, we don't recommend. If it's something low dose, a mixture of vitamins or minerals that you want to take, I would always recommend running it by your medical team first, so that they can give it the all clear that it's not going to have any negative effects with the treatment you're on. If you're low in anything, so a lot of hormone treatments can reduce your bone density. If you're low in anything and your medical team prescribed you something like vitamin D or calcium or B12 or something, then definitely take it. But if you haven't been prescribed it and you're not low in it on a blood test, there's no additional benefit above and beyond what your body needs. So there's no way your body can store it. If you're getting it through food, you shouldn't need more unless you're proven to need more. So in your diet, that should be varied and have enough antioxidants through the food that you're eating. So food first, 100%. Which I can go through more questions at the end if lots of people have questions about this. If you're also physically active, will have a protective effect, be beneficial during cancer treatment. The more active you are, the more likely you're going to be energetic and preserve your muscle mass, which also we know helps with energy levels and recovery. So active, and obviously breastfeeding can also be protective. During and after, so this is during and after, so you can eat this through treatment and continue throughout recovery. That's also a really good way to encourage those healthy cells. Eating less of the saturated fat, trans fats, processed foods that are basically empty calories. If you can avoid those, you'll also more likely to be a healthy body weight, but you're also, going to be eating foods that are going to nourish you rather than empty food. The high GI carbohydrates, so the food that's really low in fiber that your body digests really quickly and it doesn't stay with you very long. So white bread, rice bubbles, cornflakes, the food that doesn't do a lot for you, not very high in fiber, avoiding those. So having foods that are really high in fiber, what we call low GI, so the low glycemic index. So the glycemic index is a big list of carbohydrate foods and how fast your body digests them. So the high GI foods are digested really quickly and they go through your body really quickly, and they don't give you a lot, and they give you a big spike in blood sugar levels, which we don't want. And then the low GI, slowly digested carbohydrates are the ones that are going to keep you full for longer, give you more fiber, promote those really healthy stools, keep your blood sugar levels even, and have a protective effect on your cells during and after cancer treatment. Like I said, red meat, less than 500 grams a week. Worldwide, we're trying to get people to eat less red meat, no processed meats and less red meat. So that's one thing you can definitely do now, and definitely do after treatment. Tell all your friends, less red meat, less processed meat, more fish. And again, not avoiding everything burnt if you can. No overly charred, no overly burnt meats, foods. Just gone through that quite quickly, but no, we'll go through this and then you can ask questions at the end. So the other thing that is really important to know is that we can do so much with nutrition throughout menopause. There is quite a few dietary modifications that you can make that will help you feel better, have more energy. Ideally, we're trying to maintain a really healthy body weight. So sometimes hormonal cancer treatments can promote, and even steroid use can promote weight gain. Not always, and it's not a guarantee that that's going to happen, but it is something that we can, manipulate through nutrition. But nutrition is not the only thing that will help during menopause. So it is really important that you look at the whole perspective, not just nutrition, because it's often a combination of factors that really lots of women have a really hard time with. And if you're looking at a lot of different factors, they all help each other. So if you can look at the variety of things that can improve the situation for you, then they'll all feed off each other, if that makes sense. So if you're looking at your nutrition, we're trying, and I know I'm a dietitian, and I really think they should think of a different name, because we never put anybody on a diet. We're trying to move away from the diet mentality, because if you go on a diet, you come off a diet. That is basically what happens. And you often end up worse off at the end than you were at the beginning. So we're trying to move away from dieting and onto a really healthy relationship with food. And we know long-term that is going to be what helps you. So it's a lot about listening to your hunger and fullness signals, intuitive eating. So learning how to eat what you need, when you need it, how much you need. So it's learning a lot about portion sizes and food timing. So yeah, there's lots of dietary modifications, but not a diet. There's no one diet that we would put you on to say this is going to make a huge difference or this is what you need to follow. It's the modification of what you're currently eating that's going to help you. So you need to sit down with someone and go through what you're currently eating, what you think you should be eating maybe, and then create a meal plan that is going to help you. So there's no point telling everyone to do the same thing, because not everyone eats the same. So modifications, macronutrients, really healthy, 5 food groups, high fiber, good sources of protein, no alcohol, lots of water. So there's lots of things that you can focus on, but not a diet. Hormonal factors, so reducing the making the low fiber will also keep your blood sugar level even, and then it reduces insulin growth factor 1, which we know it has in lots of studies has been shown to potentially promote cancer, the growth of cancer cells. So we're trying to reduce the blood sugar level load that we're giving ourselves, so that way we're having lots of low fiber foods. And I can go into that more detail if you want me to, but that is quite a big area. So yeah, like I said, food relationship. So we're looking at managing food cravings, finding alternatives to food cravings. There is, again, depends whether you're having sweet cravings or salty cravings or cravings at night, or whenever you're having it, you'd need to, you can manipulate that with different techniques and tactics. And that might be your downfall, is that you're eating at the wrong time or eating too much. So there's little things that you can tailor to your everyday eating. Lots of people want to find out about intermittent fasting and the changing the eating window, which we definitely can do. That's the only diet mentality that I would talk to people about, but I wouldn't do it until we've tidied up the diet first. So there's no point doing intermittent fasting or without talking about the foods that you are eating first. And then if you want to try shortening the eating window, then we can do that. There is some evidence that shortening the eating window has a benefit on body composition. So that is something you can work towards if you want to, but by all means, you don't have to. There's a lot of effectiveness from what we've already talked about. But if you are eating really well, you're exercising, finding someone who can help you find ways to move, give you support at the stage you're at, then that will help optimize lean body mass. So unfortunately, as you go through menopause, as you lose estrogen, your ability to store fat goes up and your ability to lose muscle goes up. So we want to use diet to control those two things. So we're trying to maintain your lean muscle mass with really good foods, really healthy forms of protein, and exercise. Movement is key, and also reduce the risk of excess fat gain with plant-based healthy fruits and vegetables, lentils, legumes, nuts and seeds, and all that sort of stuff. So it's picking the right food to help you hold on to that really, really healthy body composition. And also thinking about menopause as multifactorial. So thinking about, obviously it affects sleep and mood, and those sorts of things need to be thought about as well, because they will also relate back to your eating. So if you're finding that you're not sleeping well, then often you don't eat as well during the day, you crave the wrong foods. So that could be something that you need to look at as well, whether it's a sleep consultant or again, you can talk to a dietitian or a physio about different ways to manage sleep, the same as you can to talk about fatigue and mood. One thing that I do recommend is at the beginning, as you're trying to make new habits, is just to be really, really organized, really, really planned with the changes that you're going to make. To make it consistent, you have to be quite boring and methodical at the beginning. And that way you'll be more consistent, and the more consistent you are, then the more the changes that you're making will really take effect. There's no point doing something for a day and then expecting it to make a huge difference. It has to be ongoing. What we say is it's not what you do one day, it's what you're doing every single day for a long period of time that will really help you to see the results that you want. So yeah, thinking about it in a planned way is really important too, to make sure that it's effective and successful. That's what I want to say, successful. So yeah, there's lots of things you can talk about and lots of areas that you can go through that will make the process easier. And it's not going to be the same for everyone. Everyone goes through it differently, has different symptoms, different things that really, really affect them. So it's finding what you need to work on first that will really, really help you, if that makes sense. Hopefully it does. Okay. So the other thing I want to talk to you about, as I talked about a dietitian not putting you on a diet. So that's one myth. Lots of people come to me and they expect me to put them on a really, really strict diet that they're probably not going to follow, particularly if you've got so much going on and you've got so much that you need to think about. You don't need to think about being on a diet, absolutely not. The other thing is that there are no diets that are going to cure cancer or 100% prevent cancer. If there was, then we'd tell everyone to do it, but there isn't, unfortunately. There's no one food, there's no evidence that eating a strict ketone diet or a raw diet or a vegan diet or Atkins or whatever it might be, there's no evidence that that is going to change the course of the disease or stop it from happening. What we do know is that a really healthy diet full of antioxidants, fiber, vitamins and minerals, nourishing your body as much as possible, reducing inflammation, reducing the risk of damaged cells, that will be your most effective tool in recovery and prevention. If you're finding that someone does tell you to follow a particular diet, then you have to be careful and be skeptical. Don't follow them just because they said their friend did it and it worked for them. Or everyone is different. Every cancer is different. Every person going through treatment is different. So there is no diet that is going to be above and beyond what you should be doing. Often people come to me really, really depressed if they've been told to go on a certain diet and they can't maintain it. And the food that they're told to eat, they don't like, and it can be really detrimental to their mood, to their mental health, physical health. It can be really, really stressful when they're already going through a really stressful situation. So we want to try and make eating nutrition as easy, as enjoyable as possible, without having to make your life antisocial and really, really expensive or tiring. You know, we're trying to make it one thing that you can do for yourself that makes you feel really, really good, makes you feel really, really empowered, and will help you through treatment, but also promote this really healthy future that you can enjoy. So you know you're doing the right things and you know you're looking after your body. We don't want to make your side effects worse. So some things like, for one, is if you're following the ketone diet, if you're adding a lot of saturated fat, or you're adding a lot of extra protein, then we know that can increase your risk of heart disease, or so those sorts of things. We don't want to give you any other lifestyle diseases or issues to worry about. We don't want to make side effects worse. We don't want to make your constipation worse because you're not having enough fiber. We don't want you to spend all your money on these ridiculous diets that are not guaranteed to work. So don't feel the need to follow a particular diet. Don't listen to the social media. Don't Google anything. If you've got well-meaning friends and families offering you advice, they obviously will, but you also need to think, where is the information coming from? if you are looking something up on, don't use Google. If you're going to look anything up, then look at a reputable website that is current. So the studies have been done recently. The World Cancer Research Fund will also publish anything that they think is going to be beneficial. Say thank you to friends and family, but just know in your head that what you're doing, you know you're doing for you at the stage that you're at, and with the energy and the time that you can give it. Yeah, I think if you start Googling things, everyone tells you that, don't they? If you start Googling things, then you can go down a minefield, and it really mucks with your knowledge, what your common senses are. So try not to do that. Try not to listen to anybody but the experts, and anything that is scientifically proven. So don't follow it just because it's in the media. I had one more slide, but that's gone. Oh, there we go. Okay, so if you need any more help, obviously, I think maybe Candice talked to you about movement and physiotherapy, and oncology trained 100%. They know what you're going through and what stage you're at, and they know what kind of exercises that can help you at the stage you are. Massage therapists can help as well. We've got, and again, oncology trained massage therapists who know what your symptoms might be and what you need. We've also got a psychologist at work who's really, really helpful to talk to patients and also their family members. So it becomes a holistic look at your whole life, really, the people in it. And so it's helpful to include everyone. If you feel that you need to talk to anyone, then that's what I would recommend as well. Ask more questions, get more help, feel like you're doing more for yourself as much as you can. Then that way you'll feel and a lot better and have much better outcomes. And always, if you're going to see a dietitian, make sure they're a New Zealand registered dietitian. Try not to see someone who isn't following anything that's scientifically proven. And if you do want to do any alternative therapy or complementary medicines, then just make sure you run it through your medical team first, which is what I do too. If I find somebody comes to me and they're saying they want to take something and I don't know what it is, I will always run it by the oncologist and our oncology pharmacist as well, because she'll know what their treatment type is and whether or not it's going to contradict it. Okay. So that's an overview of nutrition and some of the symptoms from cancer treatment. I'm open to any questions if people have had questions along the way, or if they want to send me questions.
Thank you, Gemma. Yeah, if anyone has any questions, please use the Q&A in the toolbox. So you might need to wiggle your mouse or tap your screen for that to show up. And feel free to send anything through. It looks like we might not have any questions, so we will be able to end the session here. Thank you again, Gemma and Lisa. Also, this is part of a series of webinars. In June, we're going to be covering the topic of recurrence, so keep an eye on your inbox for more information about that. If you've got any questions about upcoming sessions or would like information about our peer support groups, then you can send me an email at support@ocfnz.org.nz. Oh, and I need to throw an apology. We've got a question here. Lisa, if you'd like to.
Oh, yes, just popped up. Sorry. What do you recommend around diet with an ileostomy bag?
Oh, right. Yes. So that's one thing I was going to talk to you about. So with an ileostomy bag, it depends on how long you've had it for. And often when you first have it, they recommend that you follow a really low fiber diet, and then you slowly liberalize it to eat foods that you used to eat. So if I had a patient come to me with an ileostomy bag, that's where I would start. I'd start to talk about what information they've already got and whether or not what stage they're at. So If they're only eating really low fiber, then we slowly increase the fiber that they're eating. They'll also know a lot about hydration, hopefully, and the consistency that they need, how many times they need to open their bag and things like that. So if you're looking at wanting to follow a really healthy, nutritious diet, which I've been talking about, there's no reason why you can't do that with an ileostomy bag. It just means that you have to introduce foods really slowly to see what effect they have. So it would be always starting with foods that are soft, not likely to cause a blockage, foods that you really like, that you want to reintroduce really, really slowly. So we usually say one new food every few days, but there's no reason why you have to follow a low fiber diet at all forever. We don't recommend that at all. Obviously that's not healthy. So it just means it's a bit of a process to get to that really healthy intake that also promotes that healthy output that you can manage, that isn't opening the bag every 2 minutes, that sort of thing. No blockages as well. And so, yeah, introducing food slowly to make sure it's as healthy as possible. I hope that answers that question. I would recommend seeing someone, if you haven't already seen a dietitian after surgery with an ileostomy, I would recommend seeing someone to make sure your diet is as varied and healthy as possible within your own limitations. I think there might have been a question about bowel obstruction as well during the week, maybe. No, but anyway, that's similar. If you're at risk of bowel obstruction, then you definitely need to follow the soluble fiber foods, and depends on how bad the bowel obstruction is. But yes, it needs to be very, very soft soluble fiber to avoid a blockage. And again, see someone that can help you tailor that to what you like to eat, what you're currently eating. Does that make sense? Have I talked around that, or have I actually answered that? We'll see.
Yeah, we'll see. I have another question here, Gemma. You've talked a little bit about having protein in your diet.
Yep.
This one of our people in the webinar today have said that they've heard that increasing your fiber intake during menopause or when you're going through chemo is supposed to be a really good thing. And even
Sorry,
in
Lisa.
surgery. Would you agree? Yes.
Sorry, Lisa, I think you just accidentally said fiber when the question was about protein.
Oh, did I say protein? Oh no, sorry, protein. Sorry.
Protein.
Sorry.
Yeah.
So that you talked about higher protein diet during the webinar. And is this good when you're going through chemo and surgery? And is it helpful towards menopause, helping those symptoms that we were looking at before? And why is that the case? Why protein, not carbohydrates or fats or whatever?
Okay, so protein when you're post-surgery or through treatment is really important, because post-surgery your wound healing, and so your body's going through a lot of work to repair cells and tissue and wound heal, basically. And when you're going through cancer treatment, so any sort of chemotherapy, immunotherapy, anything like that, your energy and protein requirements go up. So even if you're eating what you used to eat, you still can lose weight because your body's working really, really hard. So if you increase the protein in your diet, then you're naturally going to also increase the calories and hopefully not lose that muscle mass that we don't want you to lose. So you'll stay more conditioned if you can keep healthy protein in your diet. And that's why we recommend to people who are losing weight or needing to wound heal or maintain weight, then you're having those really high quality protein foods every 2 or 3 hours. So the carbohydrates are important, but they're not going to give you as much, they're not going to give you as much of what you need to maintain a really healthy weight, muscle mass, and recover from all the side effects and the stress of treatment. With menopause, fiber is really important, like low fiber. Protein is important, but in the healthy amounts. Like I don't think that you shouldn't need to follow a high protein diet for menopause, because obviously we don't want you to eat too much of any kind of one food group. So you need to have a balance of the food group. So I'm not sure about high protein in menopause. But I do know that high protein during cancer treatment is effective. I think through menopause, I would be encouraging the high fiber and protein, good healthy protein in the recommended amounts. I wouldn't do high protein in that situation.
Gemma, have you heard of using kawa teas for constipation?
No, I haven't. I've heard of green tea for constipation. Kawa tea in the form of a stimulant or a form of hydration. Either of those could be of benefit.
I would have to say my experience on it has been a stimulation, but it is something that the women have talked about as finding is helpful for constipation.
So it's a stimulant. Okay, that's absolutely. So if it improves or promotes gastric transit time, so the same as coffee does, then that's obviously really, really good for constipation. If it softens stools, that's really good for constipation. If it's, I guess it's a natural product, it's going to have less caffeine than coffee. So that's potentially could be hydrating, but I'm not sure. But yeah, absolutely. If you find something that works and you don't mind taking it and it's part of a balanced, healthy diet, so it's not like you're only going to drink kawa, then there's nothing wrong with having it. Yeah, if you know it works for you. Yeah.
Okay. So that is a natural plant in New Zealand, and it has been used amongst Māori for a lot of ailments, but it has been used in some of our cancer patients for managing constipation. So
perfect. Yeah. Excellent. Oh, I'll have to look that up. Yeah. Interesting.
And I do want to just touch on something that you said around any kind of recommended diet, powder or tonic, whatever. This is just me plugging pharmacists. You're absolutely right. You can take the mixture, the whatever it is, to the pharmacist, and they will send it away for analysis, and they will come and tell you what's in it, what's going to be beneficial for your condition and what isn't, and what might react with other medications. So I'm talking about things like Indian treatments, Chinese herbs, or concoctions that have been made up for people. Anything like that, as you said, Gemma, before, and I think it was really lovely that you did, is just to tap into that resource that pharmacists will analyze it and tell you what can be of benefit or what might interact with your other meds.
Yeah, 100%. Yeah, so lots, I mean, again, it's a holistic wellness perspective now. So if you are wanting to take anything particularly, like any powders or any teas or any supplements that aren't single dose supplements, as long as they're a mixture, absolutely. So your oncology team, or particularly an oncology pharmacist, can look at what's benefiting you and what's not, what's going to, because we don't want anything to interrupt the effectiveness of your treatment, obviously. But then if you do want to take it, it makes you feel better. It might make you sleep better. It might reduce muscle ache or cramp or joint pain. You know, if you think it works for you, there's nothing wrong with taking it, as long as it's been approved by the medical team that's overseeing your treatment, because we don't do anything to harm that, which is what we want. You know, that's what we know is really going to work. So we don't want to undo any of that. Yeah. But again, we don't want your body to do more than it has to do. So we don't want your liver to work harder than it has to work already. So if you don't need to take supplements, I don't recommend it unless you're low in something. If your blood results come back and you're low in something, 100% you need to supplement. But if you don't, and you're taking a whole lot of concoctions and you're potentially giving your liver a lot more work to do, you're potentially putting cells under more stress, your body doesn't need it. You're just going to weigh it out. It's a really expensive urine.
Thank you again, Gemma. It was was really informative, and we'll be able to end the session now. So
yeah, if you have any questions, just email me. I don't mind to answer them anytime if I can.
Thank you, Gemma.
All right, lovely to talk to you all. Thank you so much.
Bye-bye.